Our next presentation will be given by Dr. Marina Brash. Marina earned her DVM from OVC in 1981, spent 5 years in a mixed animal practice, and then returned to OVC and gained a doctorate veterinary science in atomic pathology in 1991. She passed the American College of Veterinary Pathology boards in 1992. She has spent over 20 years with the Provincial Animal Health Lab as a pathologist focused on poultry and fur-bearing species. Welcome.
Hi everyone. So I get to follow Scott, which is a really hard job, but I'm hoping to be able to amaze you with some wonderful pictures as well. So Scott was really good and talked to us about optimal brooding and getting birds off to a good start. And when we go and follow the instructions that we receive from Scott, one of the desired outcomes is reduce mortality, early mortality. But how do we actually know when we've achieved that if we don't do as what Scott says? You have to record it. You have to benchmark it. So I guess that's the first part of this talk then is just what is considered normal first week mortality. Because you have to know normal to know if we're actually getting to where we want to be with reduction in that mortality. And so producers need to develop these charts for their own farms. This isn't something where you can just kind of go and cut and paste it from a textbook or from a report and say this is what my normal mortality pattern is, because then they're able to follow the trends, and as they make management changes, then they can follow to see just how then the birds are responding. Also, it allows them to compare with provincial averages. And this afternoon, I think there's some speakers from Chicken Farmers of Ontario, and I'm sure that they will go on then to talk a little bit more about provincial averages of early mortality. So the very first question then is that we need to answer then is what is the most common causes of mortality, and so again that comes down to recording what some of the most common causes are, because you have to kind of know what's going on in your barn then to be able to then understand what changes you have to make to be able to address that. And Scott has certainly started into that discussion with his presentation, and I think that Mike Petrick will also then carry on with that with his talk, overcoming some of the challenges following up the replacement of the birds in the first week. So what we're going to be doing here then is just the next part of this talk then is just talking a little bit more then about what some of the common causes of mortality are, early mortality in the poultry. And I guess what I'm hoping is that this is going to be kind of a pictorial tour through early mortality, and be able to help you relate what you're receiving on your vet reports then. So as producers, when you're experiencing mortality, you'll be taking the birds to the farm vet, and then you'll be receiving reports. But sometimes the written word can be kind of difficult to understand, so I always find that pictures work a whole lot better. So just here on the screen then, just some of the common causes of early mortality in poultry, and so we're just going to work down through each one of these categories, and I'm just going to show you some pictures that would further or better explain. So the first thing is dehydration. And so this would just be the shank of a normal chick. Just it's nice and plump, and the skin is very soft. And in this case, then we have more dehydrated shanks. So when Scott is talking about being down and just watching the movement of the chicks on the floor, he would also be able to make assessments on this, because you can obviously see quite a difference in just the appearance of the legs of these chicks. They might be trying to go to the water. He was talking about flow rates. One of the things that he was saying was that as you go through the barn, that there can be a different flow rate of water throughout the barn, but I also know that sometimes you'll find that there's some of those nipples are actually plugged, and the birds aren't able to actually access any of the water. So this might not be an issue that's barn-wide. It might be more of an issue that's kind of just tied into certain portions of the barn. One of the other findings that we do see, as well as with dehydration, so that you can tell here then just how dry the skin is on this shank. It's tightly adherent to the bone, but also a lot of times the vein that runs down the side of the shank then will be very prominent, and it's very dark, so you'll just see it as a dark purple line. Some of the other findings that we would see then with chicks that are dehydrated is just caking of urates around the vents, and just on the skin of the legs. So these birds then, rather than putting out the nice soft watery urates, the urates then are very, very dry and sticky. And when your vets would go and open these birds up then, and to look at them more internally, this would be some of the findings. So this is a bird then lying on its back, has the chest, the keel bone has been removed. This is heart and this is liver, and these tissues should be closer in color to the tissue sitting here, so more of a dark purple. And as you see that they're coated with a very white granular substance. And urates, when they deposit out on the tissues, have a very, very white appearance to them. Different from what we would see with purulent exudate, which tends to be more of a fluid and tends to be more kind of beige in color or yellow. Looking here at the kidneys, and we would see that there's pallor in the kidneys, and also plugging of the ureters with urates, again then because the material is so dry, is difficult to pass. And then pictures here then just of some kidneys that also would be affected and would be swollen and would be stippled. They would be pale, but also stippled with these really, really white urate crystals. The other place that urates, so we talk about urates depositing then on the tissues, the internal tissues, and most easy to see on the heart and the liver, but urates actually will also deposit in the joints. And so sometimes these birds, they would maybe say about the birds, farmers would talk about the birds being lame, and of course one of the most common things that we would be thinking about would be bacterial arthritis. However, you can also get urates filling these joints, and you can just imagine how painful it would be to have these tiny crystals filling and expanding those joint capsules. So one of the next common causes of early mortality is what we would call starve-outs, litter eating, and Scott was very emphatic when he was talking about wanting to make sure that these birds have got easy access to both feed and to water. And so just some of the findings that we would see with that. This is a picture of a more normal young chick, and this is a picture of a chick that is quite a bit smaller. Scott would talk about managing your weights, understanding just how your birds are growing through that first week. Started at about 45 grams of weight, and we're expecting them to, 7 times? They should be 7 times their body weight, 4 times their body weight at the end of the first week. So more normal chick, and a chick that has obviously not gotten on to feed. We've talked about dehydration, and you can certainly see the dehydration in through the shanks of this one chick, but also some of the other differences that we're seeing. These chicks, when they're hatched, they come complete with fat stores. We've got little bits of fat sitting right around the lower edges of the keel bone. Actually, that's fat sitting just in as the skin, just underneath the skin, over the stifle joints, sitting up the neck, in and around the thymus. And so then when you look at this chick, you can obviously see the difference, reduced muscle mass. Muscles are actually purple in color, more purple in color. and you have it's actually very difficult to find fat stores. This is where the crop sits, and there's in this case there's certainly no feed in the crop. So just kind of some further information then that the vets would be able to identify then as they're walking through their postmortems. We talked about the crops, and what Scott was saying was he was expecting to have crop fill show up within the first couple hours after the birds have been placed. And this crop is actually just distended with air, and this crop is actually just collapsed. Now, one of the things that Scott also did talk about was that he actually evaluates the crop fill, the consistency of it, but also the amount of feed that is sitting in the crop. Because sometimes what we do find is that the chicks may get started, they may have just a little bit of feed sitting in their crops, and then something happens in the barn, and maybe it's an issue is what you had suggested, that instead of putting down lots of feed and having it evenly distributed throughout the barn, that there was not as much access to the feed, easy access to the feed. When I was saying about these chicks being hatched and they come replete with good fat stores, so this is around the heart. There should always be a band of fat sitting around the coronary grooves in the heart, and as you can see, there's none here. Livers should be enlarged and filled with glycogen, and in this case, you can see that this liver is just very, very small and pale, and this bird has a distended gallbladder. So again, there's been no feed consumption, there's been no need for, no call for that gallbladder then to be able to dump bile into the intestine and to carry on with the digestive process. And then just look at the size of these gizzards. So when you're looking at a chick that's been a healthy chick that's up and that's eating, and they always have got that nice little kind of pendulous abdomen. They kind of look like a little bit like a penguin when they're walking. Well, what's hanging down lowest in their abdomen is that full gizzard. And so these chicks, these gizzards are tucked a little bit up in their abdominal cavity, and are certainly small, and when you would open them, you wouldn't find any feed in them. And this is just a little piece of resorbing yolk sac. So when they talked about having the yolk sacs there for some nutrition, as the chicks have hatched, and as they're being moved and being placed, they have that little bit of nutrient then to be able to carry them through until they get on to feed. So just some other findings again that we would find. We were talking about the empty crops and the empty gizzards, and sometimes what you actually do find is you'll find litter sitting in the crops, and so because the skin is so thin and that crop is just lying right underneath the skin, you are able to determine if it's like a mushy, a watery consistency, or a mushy consistency, or if it's dry crumbles, or the more irregular sharp edges of litter. And if these chicks are off feed or don't get onto feed and are stressed out enough, they actually do hemorrhage into their gizzards and down into their intestines. And that's what the brown staining then is of the insides of their gizzards. So that may again be something else that's listed on your postmortem report from your vet. One of the comments that both Dr. Korber, with some pictures that both Dr. Korber had showed and Scott had showed, was just on the length of that intestine. Then as the birds get on to feed, early on to feed, and the gut will lengthen out. And here you can see there certainly isn't a whole lot of intestine, and that it is quite narrow in diameter because there hasn't been any feed passed down through. We talked about the dried shanks, and again, pretty obvious to see here. The skin just molds so tightly around the bones and around the gastrocnemius tendon at the back of that hawk, and then you'll be able to distinctly see just a dark line, and that is just the blood vessel. Now, this chick has been able to find something to eat. However, it's not something that, and Scott talks about high quality feed being produced in Canada. This chick is eating, but instead what it's filled with is darkling beetles. And so you can see that the crop is stuffed, gizzard is stuffed, and you can even find a little bit of feed of darkling beetles down in through the actually very atrophic, very narrow intestinal lumen. And so first of all, not really good nutrition for these chicks for growing, but there also is another problem with darkling beetles, because we know that they can carry an awful lot of pathogens. And so we think about salmonella is always one that's commonly talked about, but certainly other viruses. And that just we can just make a little bit of a segue around. So the producers might say, boy, I'm experiencing another bout of whatever condition, maybe another challenge with bursal disease or whatever in the barn, or runting stunting, another viral condition. But I went and I cleaned that barn out as I was told. It had a really good clean out. It had a really good downtime. I wonder how that's being reintroduced. Well, it's maybe not being reintroduced. It's some of these viruses then may just be remaining resident in the darkling beetles, because they're just so hard to be able to eliminate from the barn. And again, that whole thing about the number of beetles and that you actually have in the barn, a small load of beetles would have less impact. Larger load of beetles carrying some of these pathogens would certainly provide more viral load or bacterial load than to be able to get into the chicks. So moving on then to omphalitis and yolk sacculitis. When we're talking about the embryology, one of the embryos, one of the last events to happen then before the chicks are hatched is the internalization of that yolk, and the skin heals over, and you're just left with these nice tiny little navels. And as you can see here, so just right there then, just that little, it's just like a little button navel, so there's still just some of that yolk sac tissue then that hasn't been completely internalized, and the skin has tried to close around it. Sometimes what we'll see on the chicks is you'll just see a fine dry thread, so just like a little dried wick, and then you can see then how then when they're then placed in the barn, and depending on the sanitation level of the barn, would be very easy then for bacteria just to be able to travel up that wick right into the yolk sac, and then from there proliferate, because as it was indicated before, that that yolk material is great culture media then for bacteria to grow. So just some other photos, just nice, a dark, there was a little bit of hemorrhage here, so you've just got that dried navel button, and it's dark brown. Sometimes they'll be coated with white, and it can be just the some urate material that's adherent. And so this just kind of gives you an idea of the close proximity then between the outer skin, and if there's a little bit of a protruding navel, and then the relationship to the yolk sac. So just a great opportunity for direct extension of the bacteria then from the outside to the inside, and then you're giving those bacteria an excellent place to grow. These are pictures of some normal resorbing yolk sacs. So this is what you should see, just a membrane structure. You can't see any blood vessels, so the blood vessels aren't congested, so that you don't have this arborizing red pattern. When we're teaching with the students, sometimes I help with some of the poultry labs with the students, and one of the landmarks that we always make sure that we point out to the students, Meckel's Diverticulum. I think that was a structure Dr. Korber mentioned during his talk about being able to transfer material antibodies through that Meckel's diverticulum from the yolk sac Meckel's diverticulum into the intestine while it's still patent. This would be in a more mature chick, and so this is all that we're left with then is just this little stalk called Meckel's diverticulum, and the yolk sac is fully resorbed. In this case, again, an older chicken, just the little stalk Meckel's diverticulum, and in this case, this chick actually has more of a little bit more of a retained yolk sac. But with the students, with the vet students, and when we talk to them about tissue sampling, or any of the vets in the field, and we're saying that we want duodenum and we want jejunum or midgut, this is the landmark that they will be using then to be able to find midgut for us, because there's certain times we need specific tissues from specific regions in the gut for examination for certain disease conditions. So again, just some more pictures of bacterial yolk sacculitis. So in this case, there's a lot of reddening of the subcutaneous tissues, so an omphalitis, and then you can see how this picture contrasts greatly with the picture of what we call the normal yolk sac, where you could barely see the blood vessels. Here, the blood vessels are extremely dilated. It's filled with dark purple blood, and if you were to open up that yolk sac, it would likely be an orangey red, very watery fluid that would pour out of that. And if you were to culture it, it would be contain large numbers of bacteria. And in this case, this is just to kind of show you the difference between more normal and just a regional area of more inflamed yolk sac in a chick. And sometimes that's all that you may have. You may not have where the yolk sacs are all totally involved in the inflammatory process. Just a small little area, and those chicks would be able to likely wall that off and go on and do well. One of the points that Scott kind of certainly emphasized in his presentation was this whole idea of stress of the chicks. So anything else that's going on in the barn after following placement, where they're being stressed. He showed the picture of that one little chick that was trying to get over the cardboard lid into that little feed pan. Like anything like that can cause extra stress on those chicks, then will certainly be affecting their ability to respond to other stressors. And in this case, then if this chick then was one of those stress chicks, it might not have been able to kind of take that bacterial infection and kind of resolve it or kind of localize it, and then go on to do well. Sorry, I'm a pathologist, and I love this sort of stuff. And so when we were talking about what we might be able to culture from some of those yolk sacs, things like E. coli, Pseudomonas, and certain species of Salmonella. Generalized bacterial infections. So we'll get through this one. Again, the chick is open. That keel bone has been retracted, and we're sitting with the heart and the liver. And so we've got white spots on the liver. We've got fibrin covering the heart and fibrin covering the liver, and a lot of times there'll be fibrin in and around coating the intestines. So if you were to get a report that would talk about systemic bacterial infection in your chicks, or terms like pericarditis, perihepatitis, peritonitis, this is what your vets would have been seeing. Just this sample was just a little bit unusual because there was actually white spots on the liver. We actually don't tend to see that very often in broilers with early E. coli septicemia. It's just not something that they do. If this was a little turkey about 2 weeks of age with white spots, I would be thinking about certainly wanting to rule out turkey viral hepatitis. Again, just some more photographs of what systemic bacterial infections can do in the chicks. We talked about having urates in the joints, but you can also have bacterial infections in the joints, and the joints would be swollen. You can have it in the feet, and so that you'll just see swelling of the feet as well. If the term osteomyelitis is used on the postmortem report, that is just infection right in the bone, and then you can also see exudate, inflammatory exudate, running up the tendons as well. And cellulitis, and then there can even be you can have infection of the eyes. And it used to be that if we saw this in turkey poults with what they called hypopion, which is just endoophthalmitis, it used to be salmonella. This was, you needed to really make sure that you checked for Salmonella Arizona. This is a condition that we do see in chicks, but we also see more commonly in turkey poults. Turkey poults, for some reason, tend to be very susceptible to fungal pneumonia and fungal tracheitis. And what little turkeys like to do is they like to actually develop these little tracheal plugs. And I can always remember one of the senior pathologists who trained me, and he would just say that exudate acted like a little ball valve, and you could have little turkey poults, and they'd be running around looking quite happy, and then all of a sudden they would keel over, and it's because all of a sudden this exudate just kind of came down and just blocked the trachea right at the bifurcation, and so they would have died from hypoxia. One of the lesions that we look for that you have to have really good eyes for, and I'm starting to, and thank goodness that we have good glasses when you get to my age. But you're just looking for these tiny gray little nodules in the lung. If you're lucky enough, you might actually see these yellow plaques, and if you're really lucky, you'll actually see the mold actually growing right on the surface of those plaques, and it can be this white fuzzy to green fuzzy material, just exactly like if you were to leave a slice of bread sitting out on your counter, and it would grow mold. These are more the little cup shape, the more typical little cup shape plaques of exudate that we would see. And then histologically, then you would just see, especially the picture of the cross section of that trachea where I showed the tracheal plug is just filled with exudate. And if you're lucky with just normal routine staining, you would be able to actually see the fungal hyphae in the center of that exudate. Sometimes we might just see the silhouettes of these fungal hyphae, these interlacing fungal hyphae, and so then some special stains may be required. Trauma, just sometimes there can be issues either on farm during unloading, where the birds there would be just various issues of trauma. You can see this is kind of almost like a degloving issue where the skin has been torn and almost pulled back and ripped off the legs. This was a picture, actually this picture came from Lloyd. This is the inside of the mouth of a normal chick. History was 2-week-old broiler chicks that failed to grow, and this is why you do a complete postmortem. Because you would have seen on these chicks would have been these small little chicks that looked like the earlier pictures of the starve-outs. You needed to look in the mouth to find the plaques of exudate, and that was where they had drank the concentrated disinfectant, quaternary ammonium disinfectant that had not been completely flushed out of the water lines. So again, complete postmortems need to be done to make sure that you get every area looked at of the birds.
Marie, we have to move on, but you wanted to wrap up?
Yep, and that's just great. And this is just one of the last pictures, just now with the different ways that we're raising birds. These birds are so inquisitive. They're very, very curious, and so this was a case where they actually had chopped up those big round bales of straw, but they had not taken the net wrapping off, and the net wrapping had gotten entangled around the chickens' tongues and extended right down into their gizzards. And this is just another picture of a gizzard that has a nail poking out through it. You'll find pieces of glass. You'll find other pieces of sharp metal. So just as we now move away from conventional caged housing or in barn housing to outside, this then would be another reason for mortality. Here. And then just necrotic enteritis. Thank you. I'm sorry.
No problem. Don't go far. I would like to make some time for questions because we are going to lose Marina after
Can
lunch.
you just say that we could have been looking at these pictures?
Does anybody have any pressing questions for Marina? If you want to take a minute to flip through those, 1 minute.
Oh.
Just the yolk sac versus navel infection, what kind of comes first, the navel infection or the yolk infection, or
Do you know what?
You can't tell from posting birth maybe?
Sometimes you can, because if you can actually see like that nice hemorrhagic navel and then the infected yolk sac. But I can tell you that there are times where that I think that the birds, they can also develop yolk sac colitis secondary to septicemia. Because think about it, any place that has blood circulating through with a septicemia, the bacteria can land and start to grow. So it doesn't necessarily have to be direct extension from the outside, the bacteria directly extending from the outside, wicking into the yolk material. It can actually be where they suffer a septicemia and the bacteria come in through the blood circulation and get into that yolk sac membrane. And to me, that's kind of it's important to be able to differentiate, but I don't know how easy that would necessarily be unless you could actually see those red navels, maybe with some exudate sitting around like the inside of that navel, and you actually had like wicks sticking out through. But whether it's direct extension or navel, incomplete navel closure versus septicemia, so on farm versus a hatchery issue.
Okay, thank you, Dr. Brash.